Basal cell carcinoma, or basal cell cancer, is the most common type of skin cancer. This type of skin cancer rarely spreads, with studies showing the risk for spread to be between 0.003% to 0.1%. However, basal cell skin cancer, if left untreated, continues to grow in size and causes local tissue destruction. While there are some individuals who possess very rare genes that predispose one to develop basal cell cancer, the vast majority of individuals in the population do not have these aberrant genes. Far and away, the most common cause of basal cell skin cancer is sun exposure. While sun exposure throughout life increases the risk of developing basal cell cancer, several studies suggest that sun exposure during childhood and adolescent years may particularly increase the risk of developing basal cell skin cancer as an adult. Patients whom have lighter skin and have a history of severe sunburns are also at increased risk of developing basal cell skin cancers. The main clinical subtypes of basal cell skin cancer are superficial, nodular, and morpheoform. The most common subtype is nodular, which typically appears as a papular nodule and characteristically has a pearly, shiny appearance and may be pink in color. The border sometimes has a rolled appearance. Small, arborizing blood vessels, called telangiectasias, are often seen within basal cell skin cancers. Dermatologists use a magnifying tool called a dermatoscope, which allows for close inspection of skin lesions. And dermoscopy of a basal cell cancer may reveal arborizing vessels, atypical red vessels, or blue-gray ovoid nests. A suspected basal cell cancer is biopsied to make the definitive diagnosis. Common biopsy modalities include a shave biopsy or a punch biopsy. Once the diagnosis has been established, treatment options should then be discussed with the patient. The goal of treatment is to remove the skin cancer in its entirety. Commonly used treatment options include surgical excision, electrodesiccation and curettage, known as ED&C, topical anti-cancer creams, and Mohs surgery. The vast majority of patients do very well with treatment and have their cancer completely and permanently removed.